Good evening guys, welcome back. So I thought of giving a video for the fluid therapy which are commonly used in emergencies. So I will start with 5% dextrose. 5% dextrose is nothing but a hypotonic solution which has only 50 grams of glucose per liter. So it has nothing else, no sodium, no chloride, no other electrolytes will be there, only glucose will be there. So in what basis we can give this, in what condition it is actually used? It plays an important role in correcting the dehydration actually. If the patient is in starving, or a patient needs some energy, or the patient you need some kind of energy to wake him up, in those conditions we can give. So the patient who has dehydration and needs of energy, you can give 5% of dextrose. So how much energy that the patient receives? He receives around 170 kilocalories per liter. So what are all the indications? It plays an important role in giving adequate hydration, or in the case of the patient who has excessive water loss, only water loss, no other electrolytes. So when the patient, you are seeing the patient with dehydration and you are suspecting he will not have any electrolyte loss, in that patient you can give. So it plays an important role in providing the cheapest fluid to provide an adequate calories to the body. Next, it also used in pre-op or post-op surgeries for fluid replacement, because those patients will be in NPO, that is nil per oral. In that patient you can give. You can use this fluid to administer certain drugs like amiodarone, etc. Next, it is also used as a liver protective in some cases, because giving dextrose and providing glucose, adequate glucose infusion, protects the liver against the toxic substances. So in those conditions you can give. So another thing I recommend that it is mostly given in the cases of hypernatremia. So in hypernatremia, though the primary treatment is giving oral fluid, you can give the correction if the patient is in altered sensorium. In altered sensorium also you can give through the Ryle's tube actually. But in addition to that, you can give 5% dextrose. So you can hydrate the patient with 5% dextrose. So it is used in the correction of hypernatremia. That's all. Coming to the contraindications. So these are the important things you must concentrate. You should never give in neurosurgical procedures, as the 5% dextrose increases the intracranial pressure. So you should not give. It can also cause damage during neurosurgery, so it is avoided in this case. Then cerebral edema. Because of its hypotonic in nature, 5% dextrose aggravates edema, that is intracellular fluid collection will get increased. So obviously there will be a cerebral edema in this case. Next, ischemic stroke. In the ischemic stroke, some research has been proved that giving a hyperglycemic fluid can further increase or aggravate the cerebral ischemic brain damage. So you should not give in CV also. Hypovolemic shock. You can ask a question, it's a fluid we can give for dehydration, but why we are not giving hypovolemic shock? Rapid infusion of 5% dextrose can cause osmotic diuresis. So keep that in mind, that rapid infusion of 5% dextrose can cause osmotic diuresis, leading to the increased urine output. It causes further dehydration, and there will be a delay in replacing the fluid in hypovolemic shock. Keep that in mind. So water intoxication and hyponatremia. So already if the patient is in water intoxication, by providing the electrolyte free fluid like 5% dextrose will cause further complication in this condition. So hypernatremia. Sir, you have told that hypernatremia is an indication to use 5% dextrose, but you are saying in contraindication also. Yes, contraindication is there only if you give the fast infusion of 5% NS, not by the slow infusion. While we are giving fast infusion of 5% dextrose in hypernatremia, as I said before, there will be an osmotic diuresis which aggravate further hypernatremia. Keep that in mind. You should give only in very slow infusion of 5% dextrose. Next, blood transfusion. If a line is going with 5% dextrose and blood transfusion, there will be hemolysis occurring on the IV line. Next, obviously we won't give 5% dextrose in diabetes mellitus and hyperglycemia. Next, at what rate we can give? At the rate of 0.5 gram per kg per hour. We have already seen that per liter has 50 gram. So according to that you can calculate over the weight. So you have to monitor for the osmotic diuresis, that is monitor the urine for glucosuria. So in that way you can prevent any contraindications or complications of this. Thank you. Please subscribe the channel. Please like the video. Thank you.